Hey everyone, and welcome back to the channel. Today we're going to talk about something many of you have probably experienced, especially when you have a cold sinus pain. That stuffy, congested feeling, the pressure behind your eyes and cheeks. It's the worst. But what exactly is going on in there? What are sinuses and why do they cause so much trouble? Let's break it all down. First things first, what even are sinuses? Think of them as small, air-filled pockets located within the bones of your face and skull. You have four main pairs. The frontal sinuses are in your forehead, right above your eyes. The maxillary sinuses are in your cheekbones, on either side of your nose. The ethmoid sinuses are a bit more complex, a honeycomb of small cavities between your eyes. And finally, the sphenoid sinuses are located deep behind your nose, near the base of your skull. So, what's their job? Well, scientists believe they have a few roles. They help lighten the weight of your skull, which is pretty neat. They also produce a thin layer of mucus. Now, I know what you're thinking. Mucus? Gross. But this mucus is actually super important. It acts like flypaper, trapping dust, pollutants, and other junk you breathe in. It also helps to humidify the air you inhale before it reaches your lungs. Tiny, hair-like structures called cilia then sweep this mucus and all the trapped gunk out of your sinuses and down the back of your throat, where it's harmlessly swallowed. It's a fantastic self-cleaning system that's working 24/7. Everything is great when this system is running smoothly. The problem starts when your sinuses get inflamed and blocked. This condition is what we call sinusitis. When you get a cold, an allergy flare-up, or some other irritation, the delicate lining of your sinuses can swell up. This swelling can block the small openings, called ostia, that allow mucus to drain. Imagine a traffic jam on a highway. The mucus is traffic blocked opening. A roadblock. Mucus has nowhere to go. So it starts to build up inside your sinuses. This is when you start feeling that awful pressure and pain. The warm, moist, stagnant environment created by the trapped mucus also becomes a perfect breeding ground for bacteria or viruses to grow, which can lead to a sinus infection. So when you say you have a sinus headache, what you're really feeling is the pressure from this buildup of fluid and the inflammation in your sinus cavities. Depending on which sinuses are affected, you might feel pain on either side of your nose, between your eyes, or even in your upper jaw and teeth. That's why sometimes a sinus issue can feel like a toothache. Other common symptoms of sinusitis include a stuffy or runny nose, losing your sense of smell, and postnasal drip, which is that annoying feeling of mucus dripping down the back of your throat. You might also feel tired and just generally unwell. Now, it's important to know there are different types of sinusitis. Acute sinusitis is short-term, usually lasting less than 4 weeks, and often happens after a common cold. Chronic sinusitis, on the other hand, is when the inflammation lasts for 12 weeks or longer, despite attempts to treat it. This can be caused by ongoing issues like nasal polyps, a deviated septum, or persistent allergies. These help to reduce swelling and thin out the mucus, allowing your sinuses to drain properly again. But if your symptoms are severe, last for more than 10 days, or if you have a high fever, it's always an idea to check in with a doctor. They can determine if you have a bacterial infection, might antibiotics, underlying issue. So there you have it. Your sinuses are a fascinating, hard-working part of your body. They're really not just empty spaces in your head. They're a complex, a system designed to protect you. In sinusitis, what happens when that system gets blocked and inflamed? Understanding it a little less easier to feel to pressure. I hope this helped clear things up for you. If you found this video useful, please give it a thumbs up and hit that subscribe button for more health. Let me know in the comments if you have any questions or what topic you'd like me to cover. Thanks for watching, and I'll see you in the next video.